I'm a professor in the Department of Medicine in the School of Public Health at UCLA. And along with Dr. Wang, I've had the pleasure of co-directing the Workforce Development Program for the CTSI since 2011. And we've been doing this K Award workshop really for the whole 5 years. And one of the things I always ask at the beginning is, how many of you are coming to this for the first time? Great. And it always seems that way, you know. And so we take this on the road. We take it to Cedars. We do it sometimes in Westwood. And most of the time we have new people. And at this point, I don't know if Lisa Chan is in the room, but you know, we've had hundreds of junior faculty do this workshop, and sometimes do this workshop, and then when they're actually in the active writing phase of a K Award, do something called the K Studios that Mitch Wong, who runs the KL2 program, will be talking about in his talk, which is a more intensive one-on-one level of help so that you can write a really competitive proposal for the NIH. So what I'm going to try to do is just demystify the K Award process. And one of the things that's very challenging is there are a lot of different types of K Awards. And I don't have all of them on these slides, but on the NIH website, there's something called the K Kiosk, and they will show you all types. The other thing is, we make all the slides available to everybody, right? Yeah, and so, you know, as you're taking notes or listening, realize you'll have the whole slide pack from all the talks today. We usually post them on the website and anybody can download them. So a KL1 is for clinicians or PhDs in the field of epidemiology and outcomes research. And you must have accomplished independent research experience after earning your degree. So this would be really after, say, a postdoctoral fellowship. A KO8 is salary and research support for full-time supervised career development for research that doesn't involve patients. So the important thing there is a KO8 could be research that involves people, like in communities, but not patients, okay? But typically, the KO8 is a mechanism that many basic scientists might be using. The KL2, which used to be called the K12, is an institutional award. Okay, so the way to think about this, the other K mechanisms, you as an individual write the proposal, you submit it to NIH. What the KL2 is it is a group of K awards that are awarded to our 4 institutions, CTSI, and then locally, we can decide who to give them to. Okay, so the nice thing about the KL2 is that it's a quicker turnaround because it's a local process. What Dr. Wong, who runs the KL2, does is he convenes a study section that consists of faculty, scientists from Harbor, from Cedars, from Westwood, and from Drew. And we run exactly what an NIH study section would be to be able to score the grants and decide which ones to award. So the KL2 process is just like an NIH process. And you might have noticed that Dr. Wang talked about Jenny. So Jenny initially had a KL2. A lot of times what we do is once you have a KL2, we try to help you apply for an individual award at NIH. We do that for a couple of reasons. First of all, the individual award is in your name, and it starts that relationship building with an institute where ultimately you're probably going to write an R award. So it's good for your CV, and it also is an award that you can keep for 5 years, where the KL2 you can only keep for up to 3 years. And also, if we're successful in moving our KL2s off the KL2 onto federal awards, then we can award more KL2s to people. So it's really win-win. And we have had a couple of people move from our KL2 program to individual Ks where they've actually gotten perfect scores when the grants have been submitted to the feds, to the NIH. And so we do a lot to make sure that we provide you with the support so that you can write the strongest possible K award. We also have a library in the CTSI, an electronic library of successful K awards from the various institutes. And that library is available to all of you as somebody at one of the CTSI institutions. And so there's nothing better than looking at a recently funded grant from the institute that you want to apply to, because it gives you a real sense for what they're looking for. The K-23 is a very common mechanism that our clinician scientists who want to do patient-oriented research apply for. So this is salary and research support for full-time supervised career development in patient-oriented research. And when you apply for these, you have to have completed your specialty training. So these are really awards for people who are like first year on the faculty or second year on the faculty or third year on the faculty. The K-25 supports career development of investigators with quantitative scientific and engineering backgrounds outside of biology or medicine, but are, committing themselves to basically behavioral or biomedical research. So sometimes these are people with PhDs in biomechanics, bioengineering, those type of specialties. The K-99 ROO is a new grant mechanism, and what this is it's kind of like a hybrid bridge to our funding. So the first 2 years are like a K award. It's a mentored scientific experience. And then the back 3 is an independent R-type grant. Chris Evans is a person who comes in and talks more in detail about this award. In our CTSI and at UCLA, we haven't had that many people apply so far for these K-99 R00s. And one of the reasons why is to qualify, you have to have a clinical or research doctorate and no more than 4 years of postdoctoral research training at the time of your application. So this is kind of a narrow group of individuals. And many people who are in that situation, they're kind of qualified to go ahead and write an R01, which gives them a lot more money. So there aren't that many people who are like exactly at the right phase and stage for this one. So it's not that we don't like this mechanism. It's just that we haven't had that many people who are like just at that point where they would be eligible for this. Go ahead.
Why would someone want to pursue that rather than a 5-year K? Well, I guess what would be
there is more money in the R00 part for the projects. So the K award pretty much gives you a stipend and gives you a small research budget. It's about $25,000 a year at most of the institutes, where the R00 is funded more like a real R award with more project infrastructure. So you can look at the K Award Wizard on the NIH website, and the link is here. You'll see some tools to help you figure out which is the right type of K award for somebody with your background and what you want to do to apply for. At the end of this talk, I'm going to also talk about something called a diversity supplement. Because oftentimes for brand new faculty or for people at the end of postdoctoral training, the diversity supplement is a very nice bridge to help you strengthen your dossier, to help you get a few publications in the area, and to get some work underway to make your K award more competitive. And the nice thing about diversity supplements is they don't go to study section. They go to what's called administrative review, which means that the administrative staff inside each of the institutes looks at these. They're a short application, and they have a quick turnaround time. So a lot of times they can provide some salary support so that you can protect your research time while you're trying to strengthen your science so you're more competitive for a K award. And so this is a very underused mechanism at NIH, and one that we've actually used a lot. I'll talk to you some about that at the end of my talk. Okay. So this is a picture from the NIH, and it kind of helps you know on the developmental trajectory from med school through independent investigator, which of this, complicated set of awards should you be going after when, okay? So here you see, this is the KL2 program. It used to be called the K12. They haven't updated the picture on their website yet. So you could be at the end of specialty training, or you could be like a pretty new junior faculty member, and that would be like the right time to be going after that one. The K08, again, is for junior faculty, as is the K23. And then when you're further along, there are some mid-career awards, the K24. So this might be somebody who might have started out maybe as a clinician educator, and then 3 or 4 years on the faculty decided they would like to transition to being a clinician researcher. This would be a kind of award you could apply for to protect your time so that you could do the educational program needed and the mentored project needed to make that transition, okay? And then, there's other K awards that you'll see further along in the pathway. This is more from the website, and this picture is really for people who have a research doctoral degree. So I think when you look at this picture, it's similar to the last one, which is more for clinician scientists, but this one is more for PhD scientists, and where in the developmental pathway one might be applying for these awards. And again, you can, along with these pictures, if you go to the link, there's some text explaining the rationale for who should be applying for which ones. So, it's very important to apply for the award that is most appropriate for you, because you don't want to go to all the work of doing one of these applications, submit it, and then get knocked out of the ring because you're actually not eligible for the one you applied for. Okay, so spending a little time familiarizing yourself with the K Award kiosk at NIH and figuring out the right one for you is a really important first step. Now, there are a lot of other types of awards too. So when you're applying to NIH, some of you, if you've completed a research fellowship, you might have been on an F-32. These are training grants that are awarded to institutions. We have a lot of them in our CTSI environment at the various institutions, and they a lot of times will support postdoctoral training in people who, say, already have a medical degree. And then again, you see where the K awards fit in. You see that K99 R00 is really for somebody who's on the faculty, not for somebody still in fellowship. And then you see, some of the ones further along. What about diversity supplements? So as you'll learn at the end of my talk, diversity supplements are available for people from high school up through junior faculty. So this is really important for you to know, because you might be a brand new faculty member, and you may have a project, and you would love to, say, maybe mentor a summer high school student or a summer undergraduate to work in your lab or to work in your community project. And you could, as long as there's a parent grant that's funded by NIH, you could apply for a supplement to support that student's time so they could get paid working with you in the summer. And so this is great for mentoring and bringing along the next generation of scientists. And it's great for you because if you can get one of these on your grant, it's basically free labor, so it expands the budget of your grant. And, and it gives you a chance to be a mentor and develop somebody else, which is always a nice thing to do to, pull up the next generation of scientists. And very important to do right now because, the proportion of people going into science is way lower than what our workforce needs. So what about time commitment and salary caps? So I get a lot of questions about this. So for virtually all of the K awards, you have to show that you have 75% protected time to do the research, okay? Now, they make some exceptions for people in the procedural specialties. So if you're a clinician researcher and say you're a neurosurgeon and you spent 10 years learning how to do neurosurgery, you're going to lose your skills if you're only doing it 25% time. So for surgeons, there is this 50-50 option. And I have seen that also requested for some people, say in the more procedural parts of medicine, like if you're an interventional cardiologist and a researcher, you could ask for the 50-50 split. Good news for you guys, NIH increased the salary cap on the K Awards. They used to always just be $75,000 a year, and they took it to $100,000, which still doesn't cover 75% of a lot of people's time, but it comes a little bit closer for entry-level faculty. And you can, in the NIH guide, there are these notices whenever there's a policy change like this, and so that actually is the number on the notice. If you Google that number, you can see the text of the policy change. How many of you subscribe to the NIH guide? Okay, so after this talk, that's going to be the most important thing for you to do. So the NIH guide comes out once a week, and it shows all funding opportunities. Okay, now, you're not ready to be applying for R01s if you're in this room, probably. But what's really important is to skim the NIH guide so that you get a sense of what the various institutes are interested in funding. So it sort of helps you put your research into the larger national context. And it also will help you decide which institute you might want to apply for a K award. So if you do, community-based obesity reduction research, you're going to want to look and see which institutes seem to be interested in obesity and which ones are going to be, sort of having something in their strategic plan or research portfolio that's more geared toward you. So I always think, as soon as you can, be on that link, just kind of skim and see, what's being funded where, what's a priority, and it starts to familiarize you with the organization of the NIH and where you might fit in. The salary cap at NHLBI also got increased, and you can see the link for that one. Now, there is some variability and exceptions at the institute level. So once you decide where you want to apply, you're going to want to look at the institute level. So for example, at the National Institute on Aging, there's something called a Beeson K. And the Beeson K has one study section a year, special study section. The applications tend to be due in the late fall. And it's a more generous K award because it's co-funded by the Beeson Foundation and the NIH. And so, and also like Beeson K23s, they're very special people at NIA. And so there's a lot of effort on the institute side to help the Beeson Ks make that successful transition to our funding. And so you're in sort of like a special little club at NIA if you get a Beeson K, and it's always nice to be in a special club because this is a pretty competitive thing that we're all doing. And we've been very successful for those of you who do aging research, getting people the Beeson Ks. The other thing about NIA to take note of is Congress infused a huge amount of money into NIA for Alzheimer's disease research, $300 million was awarded in the last year. And I can tell you from talking to NIA leadership that they didn't have enough qualified scientists around the country to distribute it all. And so the pay line for people doing Alzheimer's or cognitive decline research was much more generous than other fields. So again, how would you know that? You'd only know that if you were a regular reader of the NIH guide, because of course, anytime something like that happens, it's always announced. It's required by law that it be announced, okay? So, you know, sometimes things will happen in your field that if you're not reading the NIH guide, you wouldn't know about it, and so you might miss opportunities. So what about getting additional salary support while on a CDA or Career Development Award? Now, this is really important because cost of living here in Los Angeles is quite expensive, and for many faculty and fellows, you know, making ends meet just from the money from the K Award is not going to work. So there's some rules about this, but you can get extra compensation, especially during the last 2 years of a mentored K application. NIH will permit you to get concurrent salary support from any peer-reviewed grant from any federal agency. So the old rules were if you were on a K Award, you could not take other sources of federal salary support ever until you were done with your K Award. And so NIH kind of acknowledges that that was creating a problem for people, because a lot of times by the time you're 4th year on a K Award, you're ready to write that R grant and you're ready to support some of your salary on that R grant. So they changed the rules, which is good. You have to meet the following criteria, though, to be able to take salary support from both. You got to be a PI on a competing research project grant or director of a sub-project on a multi-component grant. So at all of our institutions, there's some grants called P60s and P30s. So what these are is, these are like grants that provide core infrastructure for science, but also will have 3 or maybe 4 projects. And each project on its own would be kind of an R01 size project, okay? But they're all clustered under the P60 because it's efficient. Maybe all of the projects use a certain technology, and that technology is expensive. So having the P60 mechanism, the NIH pays for the technology once, and then everybody uses it, right? And so, or it might be that it's thematic, right? So it might be around, you know, something, an important discovery for HIV positive people or something. So some of the P60s are thematic, or, and I know there was a P60 at UCLA, a community-based P60 on stroke prevention. You know, so there were different projects taking different angles of stroke prevention, and they were all in the P60. So if you are the PI, say, on one of the sub-projects on a P60, then you can take salary support from both. So that's really what this first bullet is about. And the second is the second criteria is your K Award is active when the R, the P, or the U grant is submitted. So U grants are cooperative agreements. So we're going to go into this more, but a cooperative agreement is a little bit different than an R grant. So an R grant, you're an independent investigator, you think of the science, you apply, you get your money, and you have a lot of independence on how you execute that science. A cooperative agreement is in partnership with the scientists inside the NIH. And so it is more constrained in terms of the science, because you have to have a collaborative agreement with the scientists inside the institute who are on the project team. But because the institute has more oversight, a lot of times these projects will be better funded and larger. Okay, so you know, I personally have funded the majority of my research program on cooperative agreements since 1998. So I mean, they're a really great viable mechanism, but you know, you have to be kind of a collaborative person because there's a lot of brokering and negotiating, but it does open up the door to doing bigger things. And also a lot of times the scientists inside the institute are very talented, and you don't have to carry them on your budget. And so you know, a lot of times you'll get statistical support or an economist. In the case, I do health services research, that you don't have to pay for. So that that leverages the project and the science too. And I've developed some very nice long-term relationships with many of those scientists. We've continued to collaborate together. If you can, in the third or fourth year, get some funding from one of these other federal grants, under that circumstance, you're allowed to reduce your K award effort to 50% from the 75%. So that makes room to do the work on the other project. So what about leave or temporary adjustments in percent effort? So I get asked this a lot too. Or what about part-time appointments? So, sometimes we're in stages or phases of life where it's not really feasible to be full-time. I've had faculty who I know who are awarded K awards and say, they have a complicated pregnancy and a child with special medical needs in the first 2 years of the child's life. And, the faculty member wants to be fully engaged taking care of that child and wants to go part-time to make some time for a couple of years until things medically stabilize, right? Well, in the old days, that meant you had to give your K award back. Okay, but there was a team of people nationally, I actually was on the team, that worked for almost a decade to change that rule, and we were successful, and this note will describe the details, but this part-time leave policy was developed to accommodate personal or family situations like parental leave, child care, elder care, so that you could keep your K award if one of those things happen. Now, I promise I didn't touch anything. The important thing is this. Is it the projector, or am I standing on a cord or something? No? Okay. The important thing is if your boss tells you that you need to be seeing more patients, that isn't allowed for going part-time on your K award. So it really has to be a personal circumstance. Not something your institution is imposing on you. And, we felt like it was very important to bake that language into, the rules because obviously we know a lot of clinician scientists, especially those working at safety net institutions like this one where there's tremendous need on the clinical side, that it's very easy that kind of things start to chip away at your time that's supposed to be protected for research. So let's say you want to go part-time. What you have to do is you submit a written request to NIH's awarding institution. So if your award is at National Heart and Lung Blood, or if it's at the Diabetes and Digestive Diseases Institute, you write to the institute and you request a reduction in effort to less than 75% for up to 12 continuous months. So if you need it more than a year, you have to re-request every year. And these are considered on a case-by-case basis. And in no case will it be permissible to work less than 50% effort. Okay? So at the time of the application and initial award, you got to have a full-time appointment. And you have to be able to say, I'm going to work 75% time. So when you put it in, you can't request part-time status at the time of application. You request part-time status after it's awarded. And the way that this works is you have to commit at least 75% time of the part-time appointment. Okay, so if you're working half-time, then 75% of your half-time has to be on the K award. Okay. Now, one of the things we pushed mightily to get and we didn't get was that we wanted to say if somebody had to work half-time for a year, could you make that 5-year award a 6-year award so that they could be on the Career Development Award longer? And the NIH committee said no to that. So you do kind of lose some support. You lose some money by doing this. But I think the trade-off for people who really need to do this, though, it's just great that you don't lose the whole award. And, again, you can go back up to When you're a full-time employee, 75% coverage for that, and however many years of the award are still pending. So what about resubmissions? This is important because the vast majority of us, when we write a grant, we don't get it funded on the first round, but a lot more people get it funded on the second round. So we're all really good at doing resubmissions. So NIH and AHRQ, which is the place where health services researchers apply, will accept a new application following an unsuccessful resubmission application. The new application need not demonstrate substantial changes in scientific direction compared to previously reviewed submissions. This change was really important because a couple of years back, a decision was made that there could only be one resubmission. And the hope of doing that was that we would make the process more efficient. But what was happening was a lot of people were getting knocked out on that second round, and then they had to start all over. And the way the rules were written, the new application couldn't have a lot of overlap with the failed application. Well, that's not the case anymore. So you can go back in with a new if you've had an unsuccessful resubmission. Now, but it's very important that NIH will not accept duplicate or highly overlapping applications at the same time. Okay, so you have to, wait until you've got your comments and it's clear that the first application isn't being funded before you can submit a new application that has a substantive amount of the same science in it. Okay, you can read this in detail if you're in this situation. The other thing that I think is very important, though, to note here is that NIH will not accept a resubmission that's submitted later than 37 months. So a lot of times we might get comments back, and our first response when we read those comments is anger over how stupid the reviewers were. And there is this kind of impulse to just shove the thing in a drawer and forget about it. And it's okay to do that for a week, but you don't really want to leave it in the drawer for a really long time. There's some good reasons why you want to try hard to resubmit in the next cycle. And the most important reason is that study sections turn over. So most people who serve, and the people who serve on study sections are people like Dr. Saluski and me and the professors who do research who are tenured. We will do that as a big volunteer job, but it's a 3-year term. So think about it. In any 12-month period, a third of the group is turning over. Okay? So you have a 1 in 3 chance that the person who was the primary reviewer on your proposal will no longer be in the room when the resubmission comes back in. That's especially true if you wait a long time. Because if you wait 2 years, then 2/3 of the group has turned over. And the risk there is you can do a beautiful job addressing the old comments, but now we have a whole new crew of people in the room and they have all different comments. Okay? So you really want to kind of be efficient, because if the person who was your primary and secondary reviewer is still on the study section, your revision goes back to them. And they can tell the group how good of a job you did. Okay, so the longer you wait, the less likely that is to happen and the harder it is to get funded. So, after you've read through the comments and you've gotten, over your anger, it's really important to sit down and, meet with your mentor and map out how you're going to respond. And, you also need to make a decision about, can we respond, right? So, some of the comments will just be dead wrong. So I don't know how many of you have met Dr. Keith Norris, but Keith Norris and I submitted a grant it was about 1.5 years ago. And 2 of the reviewers totally ripped into us because they said we didn't have a medical sociologist on the project. We actually had a medical sociologist on the project funded at 30% effort in all 5 years, and the reviewers missed it. So, so that's like a real addressable problem. I mean, that's definitely worth going back in. Now, it's unfortunate that you can't just like call the, project officer and say, the idiots didn't see that we had one on the grant, because now we've lost 9 months. There's no way you can't like complain, okay? There's no complaints department at NIH, okay? I mean, all you can do is like graciously respond to the comments. So, how do you graciously respond to that, right? You say, reviewer number 2 and 3 noted that we didn't have a medical sociologist. Actually, we had Dr. So-and-so, who's a tenured professor who works exactly in the field, and we apologize for not making this clearer in our initial proposal. That's how you say it. Okay, so I mean, there's no place for anger or criticism. Okay, and so you write your first response and like you're angry, right? I mean, they say your power calculation was wrong. Your power calculation actually was right. But you and so you have to have friends or mentors who will then take your first draft and make the language nice. Okay, so a lot of times like, you're just going to be too invested to like say it nicely. But if you can say it accurately, then you can rely on a colleague or a mentor to clean it up and make it nice. Because I'll tell you, when the responses come back in that are angry, you have to understand that, those of us who serve on study section, it takes hours. I mean, it's like a crazy amount of time. And, especially the West Coast reviewers, you have to fly to Washington. It's like, but the travel time is what, 4 days every time? And 3 times a year. And, how many hours did it take you, Dr. Saluski, to review the proposals before you went in?
I was there last week. I spent almost a week.
Yeah.
Full time. Reviewing projects.
Right, and so now the generous NIH, how much was your honoraria for that week? $200. Okay, so when when my kids were little and I would serve on study section, how much I was being paid with the honoraria didn't even cover the child care for the time I was gone. I would end up paying about $1,000 more during that week for child care because I was away. So you got to understand, why do people do this? Why would you do this? Don't you have better things to do with your time? We do it.
You ask this question, it's time.
Yeah.
I don't know. There is something about this system, the review system, which is fair.
Yeah.
Because obviously you take your time because you don't want to criticize somebody that maybe you felt that the grant was correct. You feel some responsibility.
Yeah.
And you feel for the person, whether you have the expertise to review the grant and all these kind of things. I don't know. We do it, as many things that we do because of the goodwill of... you feel a responsibility.
Yeah.
On the other hand, it's recognition of what you know.
Yeah.
And which is, they recognize that you are an expert on this, and then they ask you to review. You sit down around peers that have your expertise, and also you can learn, from others. So there are a number of things. What's going on in another area, and maybe I kind of overlap with your stuff, and something I can bring to my area. So you learn also. You always learn because just by reading grants, also maybe you'll give you idea to your own grants. Styles,
right. So you get to shape the field.
Yeah.
The peer review process would not work if we didn't all volunteer. I mean, who would be left in the room to make these decisions, right? And you do learn a lot, right?
It's fair. It's really, I would say it's fair.
But at the same time, if you're an assistant professor, don't do this because it's very time consuming. Wait till you have tenure. You will learn a lot when you do it, but don't. It's too much time to do it before then. So
a lot of time, I tell you, because you need to write, and what you write is. Because you need to defend whatever you write in front of the other people. When you go there, you don't know among the other 15 in the table who are the other 2 who are also reviewing that grant.
Right.
So there is a whole thing about you put a score, then you see what happened, this is electronic, and then you stand up. Oh, you were the reviewer. I didn't know you.
Yeah.
So you need to be You need to be honest about it. So it takes time. It really takes time.
It does.
It takes time.
I mean, in the good old days, we would like get on the red eye from Los Angeles with a banker's box of
Yeah,
proposals.
exactly, yeah.
So at least now everything's on your laptop. Right. I remember getting on the plane, they're like, why are we going to let that in the passenger cabin? And I'm like, oh, I have to read all these while I'm flying to Washington tonight. And so yeah, at least now it's easier to get on the plane because they're all on your laptop. But so anyway, so let's talk. Actually, can I have a time check? I can't see a clock from where I am. So what time is it? 9:45. Okay, because I think I have till 10:15, right? Okay, good. Just want to make sure I'm pacing myself here. So we're going to talk a little bit about the government and how it is structured and where your grant actually goes. So these are a bunch of acronyms that you need to master. So NIH, I think you all know. AHRQ is the Agency for Healthcare Research and Quality. PCORI is an organization that was created by the Affordable Care Act, called the Patient-Centered Outcomes Research Institute. It actually sits outside of the U.S. Public Health Service. It's a public-private partnership, and it is funded by a 1% tax on all health insurance premiums in the country. Okay, so this was started as part of the Affordable Care Act, and it is unclear where PCORI will be in a few months. So I would say don't apply to them right now, okay? RFA is a request for applications. An RFP is a request for proposals. A PA is a program announcement, and an FOA is a funding opportunity announcement. So what's the difference? So the RFA and RFP are requests for proposals in a specific area where Congress has allocated the money for that area, and if the institutes don't spend it on that, they don't get to spend it. Okay, so if you can find an RFA or an RFP in your area, they're going to have to fund some grants under that announcement, okay? And a lot of times what you can see is in the actual text of the announcement, it'll say like how much money there was allocated and approximately how many proposals they're going to fund. So, they might say $6 million is, appropriated to this, and we hope to fund, 10 to 12 proposals. So that's telling you should write like a $500,000 proposal, right? And so, and if you write a good proposal, your probability of getting funded under an RFA or an RFP is greater than if it's under a program announcement. So what's a program announcement? A program announcement is basically an unfunded mandate. Okay, so this means that when NIH went and did their annual dog and pony show at Congress said, oh, you're not spending enough money on spinal stenosis, okay? And so NIH, to be responsive, will write a program announcement, but they may not actually have specific money allocated under that announcement. Now, it still is good when you write a grant, if there's not an RFP or an RFA, to say what program announcement you're coming in under, because NIH does need to honor that they are funding in the areas that they say they want to, but there isn't specific dollars allocated for that announcement. And so that doesn't mean you won't get funded. It just means that they don't have to fund in that area, okay? So how does NIH work? So we have the U.S. government at the top here, and then we have the congressional appropriation. Now, the good news is, like, Congress historically has had extremely strong bipartisan support for the NIH. And I don't know how many of you followed, like, the Cures thing last fall. I mean, the NIH budget just got a huge bump from that decision by Congress. And then the institutes allocate money to each or the NIH allocates money to each institute. The institutes are not all the same size, okay? There's some extremely big institutes like NCI, National Cancer Institute, and then the smallest institute is the National Eye Institute, okay? And, there's like 2 decimal point differences between the funding levels for those 2 institutes. So if you look and read about the institutes, you can see how big they are. You can look at the proportion of their portfolio that they spend on K awards. You can see which K awards they fund in your field. So there's something else that you all should know about, and that's the NIH reporter. So when you get online and you're trying to figure out who's funded in your field, you can put in keywords, and all the abstracts that are funded will pop up for you to look at. These are, when you're sitting alone, in your car or in your office, these are investigator-initiated awards, your ideas, okay? The Institute has their ideas too, that are oftentimes being responsive to Congress, and so for their ideas, you'll see them described in these awards in the NIH guide. So how do you get your toe in the door at the NIH? So you've got to establish relationships with the program officers at the Institute in your research area, okay? I have to say that like 5 times because that is extremely important. You don't want your grant going to a study section where nobody's ever heard of you and nobody's ever talked to you, okay? Now, at each of the institutes, they handle career development awards slightly differently, but every institute usually has one project officer who's like the career development award person at that institute. And that's like really key because most of the time, the people in these positions like developing young faculty and they like talking to you. I've only once run into one person at one unnamed institute who was like not very nice, but I think in general they tend to be really nice people who want to be helpful. So, when you're writing your individual K, as soon as you've got those specific aims written, you want to look online and you want to see who the career development person is, and you want to attach those to that person in an email, and you want to request a 20-minute phone call. Just so you can introduce yourself, you can review the aims, you can find out strategically, does it fit in their institute and their plan? Sometimes you might do that call with your primary mentor too, like the two of you might be together talking to the project officer, and you will get really valuable recommendations. You might get a recommendation to shift the science a tiny bit, left or right, or you might hear that you're at the wrong institute for what you want to do, and no better time to find that out than when you're first starting to draft your proposal, okay? Now, I am speaking from experience here. The first time I wrote a K award, it was a patient-centered outcome study for patients with age-related cataracts, and this was long ago, back in the previous century. And I thought, of course, just send it to the National Eye Institute, right? I mean, why not? And so I wrote it for them, and I sent it to them. I didn't talk to anybody. It didn't get scored because their study section, this was in the early 90s, said that they didn't believe that any study should be powered on a self-report endpoint. So the patient's perception of benefit and harm, that wasn't the right thing to be worrying about back then at the National Eye Institute. So they came back to me and they said, you're a great person, you got a great mentor, you have a terrible project, come back with a different project. We'd love to see a totally different project from you. So I thought, that's crazy. This is what I'm interested in. So, so I turned around and I thought about who else might be interested. So at the time, cataract surgery was taking up 5% of the Medicare budget annually, and there was tremendous overuse of the procedure. So I thought, well, who gets age-related cataracts? Old people. So I called NIA and talked to Robin Barr, who was the project officer for K Awards up until about 2 years ago. So he had a long run because he was pretty old when I called him. They were very interested. So in a weekend, I retooled it with more of an aging focus. And it got almost a perfect score, and it was the same science. It went from unscored to almost a perfect score by being at the right institute, right? So that was a really important lesson for me to learn because I lost 14 months where I was unfunded because, you got to get your scores back, you got to decide what you're going to do next. And, if I had been smart and called people ahead of time, Natalie Carini at the National Eye Institute would have said, we're never going to fund that. you know, and then I would have known that right at the get-go. I wouldn't have lost the time. So you do need to, and I'm friends with Natalie, so you do need to establish those relationships and make sure that what you're proposing is a fit at the institute where you think it should go, because you might be wrong, okay? So the NIH is broken up into two pieces, okay? There are the programs, and that includes the institutes, and they set the research priorities. And then there is the Center for Scientific Review, or CSR. They're the people who review the grants, okay, and score the grants. So how long does this all take today, now that we have a much more accelerated process, sort of? It takes about 9 to 10 months at best. There's an initial administrative review. If you use the wrong size font, if you're missing a critical table, then it doesn't go to study section. So, you know, this is another, I can't believe I have to tell you this, but read the directions really carefully. I'm not sure why this is happening here, but it's very important to make sure that every required element is there, that you're within the page limits, that you've got the right font size, that, you know, you've got the minority inclusion table. You know, don't get knocked out of the ring on a technicality. So definitely, you know, read things. The title is important because it steers the proposal. Okay, so there's a character limit on the title, but it's very important because it helps the proposal get to the right study section. In the peer review, the study sections, as we talked about already, are made up of scientists from universities and other institutions like think tanks, like RAND and places like that. And most applications are not funded on the first round. So if you want to find out about success rates at different institutes for different mechanisms, you can look online. It's all in the public domain. So this is sort of the flow of how it goes, right? So you apply there at the top and your application comes in. CSR assigns you to a study section and an institute. Now, if you have talked to somebody at one of the institutes and they're interested in your science and they're going to request your proposal once it's scored, you want to say that in your cover letter. Now, I have talked to Dr. So-and-so at NCI, and he has indicated that this is within the strategic plan or the research priorities of NCI. So you can request assignment. CSR doesn't have to honor your request, but I've never heard of a situation where they didn't. I don't know if anybody else in the room has, but think about this. You know, here's some poor administrator who's getting thousands of proposals 4 times a year, and they have to like throw them in piles at the right institute. If your cover letter says throw this in the NCI pile, like, why would that person not do it, right? I mean, you've made their job much easier. And so you want to say in your cover letter where you think the proposal should go, but understand that there's not a requirement that they do that. If your proposal is a fit at 2 institutes, which happens sometimes, you know, like you might be a fit at heart, lung, blood, and you might also be a fit at aging. Or you might be a fit at, mental health, and you might also be a fit at maternal child health. So you can say who you think should be the primary to look at the scored proposal, but you can request that a second institute look at it too. Okay? And again, they don't have to honor that, but I've never seen them in my, more than 25 years of doing this not honor it. Okay? So that's good. That this is called steering the proposal with your cover letter. You're less likely to end up in a place where the proposal doesn't belong. When you get assigned to a study section, you will get an email with this cryptic code on it. And so the next thing you do is you open Google and you Google that code and you see who's on that study section. And you're doing that because you want to make sure that they've got the right expertise to be able to evaluate your proposal. So let's say there's a specific method or technology that you're going to use, and you look at that study section list and you don't see anybody who is qualified to make an assessment. So what you do is you call the scientific review officer, the SRO, that's CRS, assigns, or CSR assigns to that study section, and you let them know I think I've been assigned to the wrong study section. And you also might look online and see what you think might be the right study section. So they can administratively switch it, or they can leave you with that study section, and they can get outside experts for the area that you're in that isn't covered by the study section to look at the grant and to provide either written feedback or to call in at the time that the grant is reviewed. So I have been asked to be in that role sometimes, where they'll want me to look at one proposal and then call in when the review's happening. So that, I think it happens a lot. You can't pick the reviewers, and they're not going to select anybody who's ever published with you or who's at your institution. So you can't like game it using that, but at least you should make sure that the right expertise is in the room. Okay. So then the study section is going to give you a priority score. And then the institution, so the priority score, 1 is good and 9 is the worst. And they're supposed to use the whole scale, but I think what you'll see when you serve on study section someday is that there's a lot of bunching at the high end of the scale. And that happens because, I think a lot of times, especially in a funding climate where a lot of things aren't being funded, everybody, if somebody reviews your proposal and they just really love it, they're going to kind of game the score to make it really high with the hope that, you're on the right side of the line. So there is a little bit of bunching. And then, so this pile goes to the institutes, and the grants are, in numeric order. And there's something called advisory council at each institute. So advisory council tend to be, senior statesmen in the field. They tend to be, professors, National Academy of Science members, senior leaders in the institutes, and they all sit around the table and they decide what to fund. Now, the important thing is they are not required by law to go in numeric order, okay? They have to look at their whole portfolio. Let's say the top 5 scored grants were all exactly in the same field, and they're only going to have, enough money to fund 30 grants. Well, they're not going to fund 5 grants in exactly the same field. So they have the license to think about their overall strategic plan and to pull a grant up that might be in an important area and pull a grant down that might have scored better, okay? So what this means is it's really important to study important things, right? And it's really important to make sure you looked at those RFAs and you looked at those PAs and that you fit in an area, okay? My second R01 that was funded got pulled up. And the reason why it got pulled up was it was a clinical trial, and it was a community-based trial here in Los Angeles to try to improve the self-management skills of older Latinos with diabetes. Okay? Well, the Diabetes Institute recognized at the time that I had applied that there was this burgeoning epidemic of type 2 diabetes in Latino communities, that 1 in 4 over the age of 45 had the condition. And they, in their strategic plan, had a priority area to understand how to better control the epidemic in that subpopulation. So it just so happens that when my grant went to council, it was the only grant on Latino diabetics. And now, if you're down 75 in the pile, they're not going to pull you up, okay? But I was at the 20th percentile, and in that cycle, by today's standards, this is so generous. They were funding to the 18th percentile, so they pulled my grant in, and they kicked another grant out because I was in a priority area that they needed to fund. If I had been at the 45th percentile, they wouldn't have pulled it in. Okay, but because it was just right there on the cusp, they pulled it up at council. I had spoken at length to the project officer about that grant. He knew it was coming in. He saw where it landed in the pile. He advocated for my proposal during council. The project officer's there. And so that's why you want to make sure the project officer knows what you submitted, right? So you have that helpful phone call where they help you shape the science. And then, as a courtesy, when you submit the grant, you attach a locked PDF directly to that person with your thank you email. You know, thank you, you know, Dr. So-and-so for helping me think through how to make this competitive. I wanted you to know that I did get it submitted, and just for your convenience, I've attached a copy of the proposal, fingers crossed with the review process. So, like, you know, they helped you, they remembered you, now they've got like 2 times where they've heard your name, they've got your attached proposal, they're invested in you, right? And so this isn't going to help you if you're way down in the pile, but if you're right there on the edge, it will help you. Okay, so in this process, it's so competitive, you want to do everything possible to help yourself. Okay, and so this is one thing that you can do. How are we doing on time? Are we over 10 o'clock yet? 10 minutes left? Okay. There's no clock up here for other speakers, so bring your phone. Oh, it's behind me. Oh, okay, I got it. Okay. And so this is just a schematic of the scoring system. So we're supposed to give 1s to exceptional proposals, 2s to outstandings. For the seasoned veterans in the room, anybody see anything get funded below a 2? No, I still have this thing going. I haven't. I think if you're not, you know, so at the end of the day, what they do is they take your score and they multiply it by 10. So I've never seen a grant with a score of 30 or more get funded.
I have. It was a STTR grant.
Okay.
Some of the weird grants.
Yeah.
Will get scored on a different scale because of they have a pot of money for that particular mechanism.
Okay. So we talked about pots of money for particular things, and they will, that is less competitive if you can find one of those. So the final decision is at council, okay? And then, you know, you would think you might get like a congratulations letter or something. You won't, okay? What happens is all of a sudden, like the people at the Office of Grants and Contracts at your institution start bugging you for paperwork, okay? So when they start bugging you for paperwork, that's a good sign. That means that it's probably going to be funded, okay? So what do reviewers look for when they're looking at your K award? Does the study address an important problem? Did you make a compelling case? If the aims are achieved, how will scientific knowledge be advanced? What will be the effect of the study on the concepts or methods that drive the field? How might your work change the field? There's a new section now called scientific premise, and this is where you try to build this narrative in this case. Your approach. Are the conceptual framework, the designs, the methods, the analysis adequately developed? There's also a new section called scientific rigor, and you can look online to see exactly what they want in that section. Does the applicant acknowledge potential problem areas and consider alternative tactics? You know, you're going to hear more this morning about how to do this, but you know, if you think there's a tragic flaw in what you're proposing, but there's no better way to do it, better for you to say it than to have the reviewers say it, and to provide the rationale for why you're still going to use that technique, okay? Because then they know that you thought about it. Anything you don't write down, they assume you don't know about, okay? And so you're always in much better shape raising your own flaws, not to a ridiculous extent, but you know, the major ones, and then saying what your rationale is for what you selected. Work plan needs to be included. How are you going to measure progress? So this rigor and transparency is a new section. The scientific premise is where key data is introduced by the applicant to justify the project. Now, you don't need preliminary data to write a K award, but the key justification might come from the literature, right? Scientific rigor is the strict application of the scientific method to ensure robust and unbiased experimental design, methods, analysis, interpretation, reporting results. And so, you know, you're going to have to like hit all these bells when you're writing your proposal. Consideration of relevant biologic variables, and plans for resource authentication. And you'll see by looking in this link here exactly what is meant in more detail. When they change the rules like this, it's really important to pay attention. So this is also online, and it shows you an overview for mentored career development award applications, and where each of these things should go in the proposal. Okay, so the other thing you want to do is use really easy to follow bold headers and clear descriptions, so that somebody, if they have a checklist, they can check off that you did all these things, right? And it's really easy for them to find where you did what, right? Innovation. Does the project employ novel concepts, approaches, or methods? That's what they mean by innovation. Are the aims original and innovative? Does the project, challenge or advance existing paradigms? What about the investigator? Very important for career development awards. Is the investigator appropriately trained? Are you well suited to carry out the work? Is the work proposed appropriate to the experience level of the principal investigators? Is there any prior history of conducting research? Okay, now you're not going to have a ton of prior history. You'll have some, probably from your fellowship training, your research fellowship training, or if you've been on a diversity supplement, you may have some from that. But your mentor better have a lot, okay? So, because that's going to be the lead person teaching you. We're blessed with a very strong environment, and from the CTSI you can actually get some boilerplate text to help you write the resources and environment section of your grant. The budget's important. The scientific reviewers aren't supposed to make our decisions based on the budget, but you don't want like flaming errors in the budget, right? Everything has to be justified scientifically. Special items have to have quotes. I mean, obviously your research budget is tiny on a K award, so this stuff is more important for our awards. Other key areas, and again, don't skip these. They're required elements. If you don't have these and you need to have them, depending on your proposal, it won't get sent to study section even to be read, okay? And so what's the funding climate like? All this stuff came from the NIH website. And so this is Career Development Award trends from 2006 to 2015. We had a little bit of a dip there around 2013, but the trajectory now is up. And I haven't added the 2016 data because it hasn't come out yet, but my impression is that there was more funded in 2016 than in 2015. So the slope is good for you guys. So this is a table looking at, in 2011, if we look at the absolute number of applications for each of these mechanisms and the number awarded, what you see is the success rates. The success rate is just this number divided by this number, and then here's the total funding, okay? So, I always say to you guys, since kindergarten, when weren't you in the top third of the pile? Right? And so, this may feel like a mountain you can't climb, but most of you are top third of the pile people. That's how you got here, and you're at, a wonderful institution with a lot of support and a lot of mentors, and that means a lot for getting a K award. So this isn't like 1% and 2%, okay? I mean, this is within reach for most of you. So how does 2012 look? So let's just look at the percent column. There's 2011. So 2012 gets a little grimmer for the K01s, right? And the K23s look a little better, the patient-oriented one. Well, what about 2013? We're starting to see a little upsurge here for the K01s. The K23s look about the same. And then this is 2014. K23s are looking better. We're almost at 40%, right? And the other ones look slightly better. But then, a little dip in 2015, and my understanding is the success rate in 2016 is looking higher again. So, you're somewhere, if you're a K23, you're around 35-40% chance, okay? Now, the important thing to realize is that the number of applications reviewed is a mixture of first-timers and second-timers. Okay, so some people are revising resubmissions in that denominator, and it's not stratified that way on the NIH website. So I would think about this as the success rate after 2 tries for a lot of people. This is a figure on success rate and pay lines. I'll let you review this on your own. I'm going to let you skip that too, because I just want to show you a couple of slides on diversity supplements. So any R, P, or U grant is eligible for a diversity supplement, okay? And if we look at, how many of these are given every year, you can kind of see the number here. But here's kind of the interesting thing about these awards. So you see across all of the institutes, there were 560 of these awards. And the supplements are people from underrepresented groups or disadvantaged backgrounds. So underrepresented minorities, people who come from rural areas, if you had a very low income family, regardless of your ethnicity or race, you count. If you are a disabled person, you count as eligible for this. And so you can see the number of awards here. But the important number on this slide is this one. 64% are funded. Okay, so this is like easy money, guys. If you can find, the right senior investigator with the right grant that's in your field, this is usually about a 5-pager application. The turnaround is usually about 3 months, and it can provide support for you for 2 or 3 years. So if we look at the percent of all NIH expenditures for these awards, you see that it's a really small percent. And that's because these are really under applied for. People forget that they can apply for these. So now if we look at who gets it, if you remember, I told you that high school all the way up could get it. And what you can see here is that the majority of these are going to postdocs and to junior faculty. Okay, so that doesn't mean if you have, a talented high school student you want to have work on your R award, you shouldn't apply for one of these, but it's just that's a smaller piece of the pot. They don't get a lot of those applications. And then this is just the distribution of expenditures by type. And then this is at each of the levels, how big are these awards? Okay, and this is 2013 data. But you see for an investigator, the awards are on average $105,000 a year. So this would be both salary and benefits. So usually the salary support is somewhere between $60,000 and $75,000 a year, and then it also covers your benefits. If you say, okay, which groups get the most of these? And the blue bars are African Americans, and the red bars are Hispanics. But those are probably the 2 groups that they get the most applications from too, right? So I wouldn't necessarily say, if you're from a disadvantaged background or if you're disabled that you shouldn't apply. It's just that they don't get a lot of applications from those people. So I'm going to stop there.